Okay, ayan, wow. May gani, wala nag-ano karon ha, nag-lag. Okay, so we're going to continue with this, no? So, if nakalantaw na sa atong pre-recorded lecture, we have already started with the last group of your nematodes, which are your blood nematodes or your filarial worms. Okay, so of course, we start out with Wuchereria bancrofti. You also have Brugia malayi, and of course, you have Loa Loa. Now, before I forget the ideas, Wuchereria and Brugia, they are both endemic to the Philippines. Okay, lymphatic filariasis, which is again caused by the two filarial worms, they are endemic to 45 regions in the Philippines. Okay, that's according to Belisario. Pero basin, I don't know now kung basin ni gamay-gamay. Pero it's endemic in the Philippines because again, we have the vectors, di ba? Kinsa may mga vectors ni Wuchereria and Brugia, kinsa man tong duha. Kinsa ilang vectors, we have the kinsa may vectors nila, we have the mosquitoes, no? So mosquitoes atong vectors for the two, Wuchereria and Brugia, and the main vector for Wuchereria and Brugia there is sa Philippines, it's Aedes, no? Aedes species na mosquitoes, no? And usually they can be found in mga trunks sa abaca and banana leaves, di ba? Mabutangan og water dito, so dito lay of eggs ay muhang Aedes na mosquitoes. And aside from that, people that are vulnerable or prone to the disease are those that are working in the abaca farms or sa mga saging, no? Mga banana, kung gusto mga banana dyan, charot. Banana farms na mga mag-harvest, no? So sila na mga prone to that. Because again, we have the vector, so it's endemic to the Philippines. It's common to the Philippines. Aside from that, also, Angiostrongylus cantonensis, di ba? Angiostrongylus cantonensis, remember, sa itong mga key characteristics, mga press the buzzer ni Angiostrongylus cantonensis, you have barber's pole appearance and also eosinophilic meningoencephalitis. Now, take note that again, your Angiostrongylus cantonensis is the rat lungworm, okay? And we also have that in the Philippines, okay? Because we have rats din naman, we have snails, no? So common siya sa rats in the Philippines. But sa cases of human infection with Angiostrongylus cantonensis, medyo dili kayo common, no? There are only about mga 2 cases daw reported so far, okay? That's according to Belisario, pero mga pila ka years ago na to siya. So, at recent times, wala kayong mga recent cases din naman. So, ayun. The point lang is they are found in the Philippines. Okay, all right. So, ayun. So, we have started now with your blood nematodes, the filaria. Okay, the filariae. Okay. Now, we're going to continue. Di ba? Nakastarted tayo with Wuchereria, Brugia, and Loa Loa. Sa itong pre-recorded lecture, I hope, again, nakalantaw mo. I feel like wala, charot, sige lang. Okay, now we're going to continue with Onchocerca volvulus. Your Onchocerca volvulus is convoluted or blinding filaria, that's the other name. Now, what you have to take note ng dears, especially for Onchocerca volvulus, very important characteristic is that the adults and microfilariae can be both found in the subcutaneous tissue. Okay, I repeat, both the adult worms and microfilariae, the larva, can be found both in the subcutaneous tissue. Unlike your Wuchereria, Brugia, and Loa Loa, the adults of Wuchereria and Brugia can be found in sa lymphatics, no? And for Loa Loa, iyahang adults ma-find sa subcutaneous tissue. But ilahang microfilariae or the larva that they produce, silang tulo, makit-an ilahang microfilariae in the blood. Okay? Now for Onchocerca volvulus, both the adults and again microfilariae can be found in the skin or in the subcutaneous tissue. Please take note ha, subcutaneous tissue on both adults and microfilariae. So they are rarely found in your blood, sputum, or even urine and other mga samples. Okay. Now, no periodicity, no? Unlike your Wuchereria, Brugia, and Loa Loa, walay periodicity. So again, periodicity, this is a time of the day where the number of microfilarial worms or the number of worms are in greatest amount or in greatest concentration in the peripheral blood. So in a way that will guide us medtechs kung when man mukuha og blood, no? When should we collect samples from the patient? Because if we know that this is a Wuchereria bancrofti infection, then we know that we collect the sample in the evening, no? 10 p.m. to mga 3 a.m. inana. So nocturnal man ilahang periodicity. And if Loa Loa, which is diurnal, meaning sa morning sila daghan, so we collect the sample at 10 a.m. to around mga 3 p.m. Ganun, di ba? So, inanato ang time of collection because at this time, we are expected or it is expected that the microfilariae are in greatest number or in greatest concentration in the blood because again of their periodicity. Okay? Alright, but for Onchocerca, wala siya periodicity. Meaning, at any time of the day, daghan siya, pwede siyang ma-recover. Okay? Alright. Again, other names or common names, you have river blindness worm or blinding worm. River blindness, kanong river, it's because the vector, which is your Simulium spp or black fly, it can be found on rivers. Okay? It can be found in the river or dito siya muli og eggs and dito siya mature sa river. Ang imong Simulium spp. Alright? That's why it's called the river blindness worm. Blindness because it can cause blindness. So when we go to symptoms and pathology. Now, for the life cycle, as you can see, similar lang yapon siya with the rest of your filarial worms, Wuchereria, Brugia. But the difference lang is, again, asa mo live ang adults and microfilariae sa subcutaneous tissue. And aside from that, kinsa po ang vector, different po siya with the rest of your filarial worm. The vector for Onchocerca volvulus is, of course, your Simulium spp or black fly. Okay. All right. Now, we go now to your pathogenesis, no, or symptoms. Number one, it can cause onchocercoma. Onchocercomas are nodules, all right, that can be found in the body, all right? Pwede siya sa imuhang extremities, pwede po siya sa head. Now, these nodules may contain adult worms. So, pag open din mo sa nodules, there could be worms that can be found. Okay. Next, of course, because it resides within the subcutaneous tissue, it can lead to skin changes, no? Because of constant inflammation, no, constant attacks within the skin, then it can cause mga skin changes. It can cause pruritus, so magkatul sige, no? Ayan, like me, charot. Katul. Ayan, so magkatul sige, pruritus, intense pruritus. So what happens, the patient will continue scratching. Pwede siya magsigig scratch, so it could lead to mga wounds, no? And can lead to secondary bacterial infections. Aside from that, they may also be hyper or hypopigmentation. Example of that is here, kani. All right, and this is described as having a lizard or leopard skin. There are localized areas of spotty depigmentation, meaning na yung mga light colors, and then the surrounding areas are hyperpigmented. Okay, so meron same sa leopard and yung mga spots, diba? Ganun. So leopard skin, lizard skin. Okay, hyperpigmentation or hypopigmentation. Aside from that, of course, there could also be involvement of the lymphatics, no, lymphadenopathy sa inguinal and femoral region. So diri sa mga sa singit, no, sa bulog, yes, ganun. And when that happens, of course, mo enlarge mo hang lymph nodes, all right? And aside from that, skin, di ba? Because of constant inflammation sa skin and attacks by the Onchocerca volvulus na mga worms, then the skin will lose its elasticity. So pwede na siyang musag, parehas ani, all right? And this condition is known as the hanging groin, okay? So hanging groin, no? Hanging groin. So sa imong bulog dapit, ang skin dito kay nagsag, no? Nawala nilang elasticity, ayan. So, musag ang skin. So, that's hanging groin. And can lead to hernia. And aside from that, no, acute attacks of oncodermatitis against the skin, it leads to purplish discoloration of the trunk and limbs. And this is known as malmorado in Central America. So, similar siya with leishmania ninyo, di ba? That in areas kung asa ang infection, they have their own local names, no? Like mga PN boys, mga yaws, mga forest, whatever, no? So same with here. If sa Central America, purplish discoloration of the trunk and upper limbs, that is known as malmorado. Okay? All right. So that's for the first diseases that Onchocerca volvulus cause. Next, you have soda. Soda, hindi siya katong Coke. Ang pangit ng joke. Ay, nag-rhyme yun. Hindi yun Coke. Ang pangit ng joke. Charot. Okay. Soda. Soda is a chronic, no, hyperreactive form of Onchocerca volvulus. Because again, constant gyapon chronic, there is papular dermatitis, no, magsiging inflame mo skin. Alright? And there is darkening of the skin. So here's a picture. The left one is the normal color of the skin in this place, no? And then the right one here is the darkening of the skin caused by hyperactivity or chronic infections by Onchocerca volvulus. That's known as soda. All right, okay. And lastly, of course, the more serious complication good is this one. It involves, or it can involve the eyes, no? And once the Onchocerca volvulus migrate or maabot sa eyes, it can cause blindness. All right. Now, in the eyes, they produce what we call mga snowflake or fluffy corneal opacities. So as you can see, kabantay mo na sa eyes na mga white na mga fluffs, no? Ayan. So that's snowflake or fluffy corneal opacities. And that can lead to blindness, bilateral, both of the eyes. All right. That's why the disease is also known as river blindness. Okay. Now, mortality increases if an adult has a systemic infection plus napag siya involvement sa eye, no? So mortality mas taas o chance if ang humans or if ang adult na ay systemic infection by Onchocerca volvulus and also na ay blindness na involved. Okay? All right. Ayan. So that's for Onchocerca have volvulus. So that's for the diseases, no? So what you have to take note, oncocercomas, no, mga nodules that contain adult worms. You also have hanging growing, yes. You also have soda, all right, and snowflake fluffy corneal opacities, no, when it leads to blindness sa eyes. All right, okay. Ayan. Now we go now to your laboratory diagnosis, of course, because again, di ba, your adults and microfilari of Onchocerca volvulus reside in the subcutaneous tissue. Our specimen of choice is, of course, skin snips. Ayan. So we have discussed that in our first lecture, di ba? The specimen of choice for your Onchocerca volvulus infection is, of course, skin snips or skin biopsies. Because again, the adults and microfilari are residing within the subcutaneous tissue. Now, when we collect the sample, it's best, again, that blood is not contaminated, all right, or walay blood. Because again, blood can also contain other microfilari of other species. So possible na misdiagnose, no? Kaya ma-introduce ang blood to the sample. Okay? So skin snips yapon, skin biopsies ato ang best specimen, no? Specimen of choice. Next, we have slit lamp examination. So kana mga pagamaw eyeglass dira, di ba? Like imong ibuta imong mata sa murag dako na machine sa mga opta na ila kong lantawon kato ganing murag basta gets na mo sa akong point. That's the slit lamp examination, no? Ayan, for again blindness once the eyes are involved in Onchocerca volvulus infection. Next, you have the Mazzotti test. Mazzotti test is actually quite similar to the skin test, but this time ang Mazzotti test is ang patient mo drink siya og DEC, no, DEC bastos, charot. DEC the halls, charot. Ayan, so DEC, no, DEC diethyl carbamazine. Now, meron siya katong DEC provocation test sa imuhang Wuchereria, no? So, pag inom nimo sa DEC, usually ang expected results kay intense pruritus or mag-allergic reaction ng patient. And because pag sa DEC na katong original method na imong imnon ang DEC kay intense ang symptoms, no? Intense ang allergic reactions, i-change siya into a patch test that contains DEC. So, yung mo na ipatapot ang patch, no? This one that contains DEC, all right? And after pila ka hours, you remove the patch and then lantawon ni if na by inflammatory reaction na naa. And if na ay redness or redness or inflammation sa kung asa gitapot ang patch, then that indicates a positive result. Okay? All right. Now, serologic test using recombinant antigens, PCR methods, of course, more sensitive than your routine microscopic methods. Now, the treatment of choice is, of course, surgical removal, especially if you see the nodules like onchocercomas, no? All right. And sa eyes po, pwede ka mag-photo coagulation, di ba? Katong imo siyang ipaagyan o laser beam ang imong eyes para mamatay ang larva, ganun, mamatay ang worm. And the drug of choice is still ivermectin. Ayan. So as you can see, ang ivermectin para talaga sa mga worms, no? So hindi siya para sa virus. Ayan. So mga ano nyo dyan, mga kilala kayo, educate. Okay? Nako talaga, sinasabi ko. But tayo bang references nag-mention na the treatment of choice daw is DEC, diethyl carbamazine, because ivermectin can produce severe side effects, all right? But that could be an alternate lang. The main drug of choice pa rin is ivermectin, okay? So ivermectin para lang taga sa worms. Nako, sinasabi ko talaga. Okay? All right, ayan, sige. Next, we go down to the last species of your blood nematodes, your Manzanella species. The Manzanella species usually are attributed to less severe or not severe sa mga infections. And the vector is your Culicoides species or midge. Kani siya nasa picture. Okay? Alright, Culicoides species or midge. Alright. Now we go now to the first species of Manzanella, your Manzanella ozardi. Your Manzanella ozardi also known as New World filaria because of the disease na yung makos kung asan mga areas sa New World, dapit. And aside from having Culicoides as the vector, pwedeng duha yung vectors, Culicoides or pwedeng Simulium spp. Ayan. So Simulium spp or Culicoides ilahang vectors possible. Manzanella ozardi. So pwedeng duha. Next, asa siya makitaan sa mga cavities, thoracic or peritoneal cavities, and also the lymphatics. But generally, pwedeng walay inflammation. So nana siya dili siya na naka-intense, no? It doesn't produce serious infections. Alright? So Manzanella ozardi or Ozards filariasis. Alright. Next, you have Manzanella perstans, no? So your Manzanella perstans can also be found in the cavities, pericardial, pleural, peritoneal. Blood is still the specimen of choice because the microfilariae can be found in the blood. Alright. Now, still the same, little or no host reaction, but there is eosinophilia. There have been reports of pruritus, so magkatul, no? Abdominal pain, urticaria, calabar-like swelling similar to loa-loa. Alright. But again, these are not common. Quite rare lang. Now, in Uganda, please take note, dears, acute periorbital inflammation, meaning magkubag imong mata, all right, in Uganda, caused by Manzanella perstans. This is known as the bulge eye or bang-eye. So pakitake note na lang. Sa Uganda ni siya. Okay, very specific sa area. Uganda. Bang-eye or bulge eye. Periorbital inflammation of your Manzanella perstans. Okay, so perstans, di ba, kanang ako dyan i-joke. Charot. Baka fail na perstans, kanang like, di ba, magsayaw mo sa prom. So this is your first dance together. Charot! Pakitype ng ha-ha-ha to support. Thank you. Joke. Baka fail. And the last species of the Manzanella, your Manzanella streptocerca. Now, Manzanella streptocerca, similar siya with Onchocerca volvulus. The adults and microfilariae can be found in the skin, in the subcutaneous tissue. Okay? Now, very, very important characteristic or feature of the Manzanella streptocerca, shepherd's crook, shepherd's hook appearance of your tail. Ayan, ako. Ito na yung mga shepherd's crook, diba? Kinsa ganitong first shepherd's crook na itong na-mention sa sa protozoa, kinsa ganito, bago nang gitunaan. See?
Kylomastics mesnelli.
Very good. Kylomastics mesnelli. And the second one is this one, si Manzanella streptocerca. Shepherd's crook sa iyahang tail, alright? Manzanella streptocerca. So be very careful sa question, no? Kaya basta niya magsalig mo na, ay okay, shepherd's crook, Parasitology, Manzanella streptocerca. But ang question di ay kikipangutan na, this protozoa is made or has a shepherd's crook appearance. So atong answer dapat na kay Kylomastics mesnelli, kay protozoa man ang gipangutana. Pero from question kay this nematode or this worm or this metazoa has a shepherd's crook tail na press the buzzer, then that's Manzanella streptocerca. So again, still the same reminder na ako ninyo, dears, be careful sa question, read it carefully, good, read it twice if kaya pa sa time, no? Para again, maka-check to yung answer, alright? Kaya usik ang points. Okay, alright, ayan. Now, for symptoms, there could be pruritic dermatitis, magkatuloy mo hang skin, alright? Hypopigmentation and lymphadenopathy can also occur, alright? Now, changes in the skin, pwedeng sclerosis of dermal papillae, edema, incontinence of melanin, infiltrates around blood vessels, and lymphatics are also involved, okay? Because again, it can be found in subcutaneous tissue, so sa skin, ang imong mga symptoms na ma-feel, mga changes sa skin ang mo happen. Alright? So that's Manzanella streptocerca. But again, generally, the Manzanella species na mga worms are less to cause severe infections. Again, they are known to not cause serious infections. Okay. Alright. Now, life cycle, similar gapon with the rest. Vector is Fulicoides. They reside within your subcutaneous tissue. Alright. Now, we go now to the summary of mga microfilarial characteristics because in the start of blood nematodes na lecture, we have emphasized that in order for us to differentiate the different species of the microfilarial worms, alright, or the filarial nematodes, we look at the microfilariae or sa ilang larva, alright? So we look at the larva and asa na to, unsa tong lantawon, ilahang tail, alright, ilahang ikog, no? We look at the tail, we look at two characteristics specific to the tail. The presence or absence of a sheath, alright, diba, covering, or and also the distribution of the nuclei found in the tail. Alright, so unsa to na duha characteristics to differentiate the species of filarial worms. Number one, the presence or absence of a sheath sa tail and the distribution of nuclei sa ilahang tail. Alright, so muna siya natawon karon. So we'll start first with Wuchereria. No, Wuchereria again is sheathed, so nasa covering. No, it's a piece of sheath. Nasa sheath, no, sheathed. Aside from that, ang nuclei niya, it do not extend or they do not extend to the tip of the tail. Please take note, diba? So, na-mention na ako ni sa katong lecture atong pre-recorded sa atong mnemonic or how do we remember? Wuchereria, diba? Wala. Wuchereria, wala siyang nuclei sa tail. Alright? Please take note. Medyo corny pero bahala na. Okay, so Wuchereria, wala, no? Wala siyang nuclei sa tail. Please take note. Alright. Next, you have Brugia. Brugia malayi or malayi is also sheathed, parehas with Wuchereria. But very important is that sa tip sa iyang tail, na siya duha ka nuclei. Alright? And na siya bulge put around the nuclei. There's a bulge around the nuclei. So very important again, two ka nuclei, alright, at the tip of the tail. So how do we remember? Brugia, letter B, diba, is the second letter in the alphabet. So two. Na siya duha ka nuclei at the tip of the tail. Alright? Please take note. Again, Brugia malayi, two nuclei at the tip of the tail. Alright? Brugia malayi. Alright, okay. Now, Brugia timori, wala na ako na-mention here, diba? Brugia timori, how do we differentiate with Brugia malayi? Is the shape, diba? Medyo longer ang Brugia timori. And aside from that, the sheath, alright? The sheath of Brugia timori, it does not stain with gem sac, alright? Because ang Brugia malayi, di ba, the sheath can be stained by GEMSA. Alright? So take note again. Brugia malayi, ang iyang sheath pwedeng ma-stain og GEMSA, pero ang Brugia timori dili siya ma-stain og GEMSA. Alright? Ang sheath sa imong Brugia malayi, di ba, its color bright pink. Di ba? Bright pink in your area. Charot. Ayan, funny yun. I feel like funny. Charot, check lang. Okay, alright. Ayan. So take note of that. Okay? Brugia malayi, Brugia timori. So Brugia malayi, very important characteristic po sa Brugia malayi deers is that iyahang sheath must stained by GEMSA. Okay? The rest of the filarial worms usually, ilahang sheath dili must stain of GEMSA. So kinsa man ning stain? Ala, ato ni siyang i-note, ato ni siyang butangan ng points. Okay, sa mga scoreboard natin sa block. Kinsa man ning unsa man ning stain na ginagamit to stain your sheath of microfilarial worms, bahalag kinsa na species. Sa ngalan sa stain. Gitindugan nato ni. Unsa man to? Hala, first lecture natin.
Delafield hematoxylin.
Unsa to?
Delafield.
Ang galing. Marcos, ikaw ba yan?
Yes, sir.
Ang galing. Very good. That is correct. No, Delafield's hematoxylin. Don't forget, no? Delafield's hematoxylin is really for the staining of sheath. All right? Siya yun muna yung purpose sa imong stain. All right? Although your GEMSA is the stain of choice to stain your microfilarial worm as a whole, pero kung sheath ra imong lantawon para ma-visualize siya, what stain would you use? Delafield's hematoxylin. Because sa GEMSA, kinsa naman tong filarial worm na ma-stain ang iyang sheath. See? Na color bright pink in your area. Bright pink, see? Brugia
Malayi.
malayi. Okay. The rest of your filarial worms usually dili ma-stain nila ang sheath by GEMSA. So, unsa to na stain atong gamiton? If ganahan kita makakita sa sheath, bahala kinsa na species ang filarial worm. Kinsa to? See? Kinsa ganito?
Delafield's hematoxylin.
Right. Your Delafield's. Please take note ha, very specific Jud. Delafield's hematoxylin. Alright, so this is a type of hematoxylin na stain. Alright, so be specific because there are a lot of other hematoxylin, diba? Iron hematoxylin, you have, isa pa man, other hematoxylin na stains. Alright, but Delafield's hematoxylin, again, specifically to stain the sheath of microfilariae. Alright, okay. Next, very good ha. Next, we go to Loa Loa. Now, for Loa Loa, as you can see on sa description sa iyahang nuclei, continuous row until the end or until sa tip. So how do we remember? Loa Loa, di ba? So ang Loa Loa, pwede mo siya ma-longest voice, di ba? Loa Loa, o di ba? So Loa Loa, di ba? So continuous imong voice pag mo pronounce kag Loa Loa, di ba? So Loa Loa, continuous imong voice pag pronounce, continuous pud ang nuclei to the tip of the tail. Alright, di ba? So Loa Loa, ayan, di ba? Mura ko buang ato. Anyway, so that's for Loa Loa. Sheathed po siya. Alright. Next, your Onchocerca volvulus. For Onchocerca volvulus, it's now unsheathed. So, kinsa na tong tulo ka sheathed, no? So, Wuchereria, Brugia, and Loa Loa. WBL, silang tulo ang sheathed ang tail. The rest, non-sheathed na. Starting first with Onchocerca. So, Onchocerca is non-sheathed, no, non-periodic pag yun no, diba? And the nuclei do not extend to the tip of the tail. So, how do we remember? Onchocerca, nasa pangalan na. Ito yung capital ng first two letters, Onchocerca. So how do we remember? On, di ba? Atong balihon, mahimo na siyang no. O, di ba? Ayan. So no, Onchocerca, no sheath, no nuclei at the tip of the tail, non-periodic. O, di ba? No, Onchocerca. Di ba? Maraming no. No sheath, no periodicity or non-periodic, and lastly, no nuclei at the tip of the tail. Please take note ha. Onchocerca, no. O-N, balihon, no. Okay? Alright, ayan. Mga tips, mga mnemonics dears, para naman, okay, ma-remember. And lastly, for Manzanella species, the Manzanella species are unsheathed also. And as you can see, daghan ang difference. For Ozardi, same siya with your Onchocerca. The nuclei do not extend to the tip of the tail. For perstans, continuous siya, parehas ni Loa Loa. And for Manzanella, single row of nuclei, alright? Single row of nuclei, and very important, shepherd's crook sa iyahang tail. Please take note, alright? Manzanella ozardi do not extend to the tip of the tail, and perstans, no? Continuous. So, let's say perstans, di ba? That's your first dance, o di ba? First dance ay mukhang prom. So, continuous man yung sayaw-sayaw sa prom, di ba? So, ayan, continuous nuclei to the tip of the tail, And of course, Manzanella streptocerca, the last one, Manzanella streptocerca, shepherd's crook appearance. Sa iyahang tail, single row. Ayan, single. Charot. Kailangan ba i-emphasize? Charot. Single row of nuclei to the tip of the tail. Alright? So muna siya ito ang mga microfilariae of the different filarial worms. Again, we look at the microfilariae to identify them, to differentiate the species. Alright? And we look again at the presence or absence of a sheath and the distribution of the nuclei sa tip of the tail. Alright? So again, Wuchereria, kinsa itong mga sheathed, and mga sheath, you have the first three, WBL, Wuchereria, Brugia, Loa-Loa. And then the rest, non-sheathed na. For the nuclei, Wuchereria, di ba? Wala. Wuchereria, di ba? Ayan. Wala, no? Wala siyang nuclei sa tip of the tail. Alright. Brugia, letter B, second letter in the alphabet, 2. So, nasa duha ka nuclei at the tip of the tail. Alright. Loa-Loa, di ba? Continuous to the tip of the tail. Onchocerca, maraming no nuclei at the tip of the tail, and the Manzanella species, the different Manzanella species na microfilariae. Alright? Okay, so that's how we identify, no? That's how we identify the different microfilarial worms. Okay, alright. So we look now at the different characteristics, no? Kani mga from samples, good. First is your Wuchereria. As you can see, this is the tail. This is the sheath na covering. And the nuclei, kabante mo, wala siya naabot sa tip, sa tail. Alright? So that's Wuchereria bancrofti. Wala siyang nuclei sa tip of the tail. Next, for Brugia, as you can see, this whole thing here is the tail, okay? And this is the sheath, no? So as you can see, it's stained bright pink, no? Bright pink in your area, yes. Using Gemsa. And you have here two nuclei, kaning naay arrows, no? These are the two nuclei at the tip of the tail, di ba? Two distinct nuclei at the tip of the tail. And then you have Brugia timori. As you can see, it's quite longer than your Brugia malayi. And nandiyan po siya yung nuclei at the tip of the tail. But the sheath is not stained by Gemsa. All right. Okay. Next, you have Loa-Loa. As you can see, continuous ang ihang nuclei at the tip of the tail. And there's a sheath na covering. And then Onchocerca volvulus, you have here the nuclei. Kay Kotobra siya here, wala siyang extend. All right. So no nuclei at the tip of the tail. Okay. All right. And lastly, for the Manzanella species, Manzanella ozardi, do not extend to the tip of the tail. Streptocerca, continuous siya at the end of the tail. Okay. And you have Streptocerca, perstance, continuous at the tip of the tail. And Streptocerca, shepherd's crook appearance sa iyang tail. Alright? Okay, so don't forget that. Okay. And of course, para mas easy ang life, ayan, summary, tabular summary, di ba? Para mas easy ma-remember. So we look first at habitat of the adults. So as you can see, Wuchereria, Brugia, of course, are lymphatics. Loa-Loa and Onchocerca, subcutaneous tissue. The Manzanella species usually kay body cavities, alright? Except for Manzanella streptocerca, na same with Onchocerca volvulus, makitaan sa subcutaneous tissue. For vectors, Wuchereria, Brugia, again, mosquitoes. For Loa-Loa, your chrysops fly, your mango fly, deer fly, tabanid fly. Onchocerca volvulus is Simulium spp, or black fly. For M. ozardi, Manzanella species, dapat Culicoides. But M. ozardi, pwedeng duha yung vectors, Culicoides and Simulium spp. For specimen, as you can see, blood tanan except for Onchocerca and Manzanella streptocerca because the microfilariae can be found in the skin, so skin snips. All right. Periodicity, nocturnal, Wuchereria, Brugia. Diurnal is Loa-Loa. The rest is non-periodic. For the tail nuclei, again, Wuchereria, Wuchereria, wala siyang nuclei sa tail. Brugia, letter B, second letter in the alphabet, two nuclei at the tip of the tail. Loa-Loa, continuous, no? My longest voice ni mga Loa-Loa. Alright. Onchocerca volvulus, ON, no nuclei at the tip of the tail. Ozardi, parehas pod. Manzanella perstans, continuous imo ang first dance, di ba? Continuous ang nuclei at to the tip of the tail, no? Manzanella perstans, and Streptocerca, shepherd's crook appearance. And again, kisa doon mga sheathed, WBL, Wuchereria, Brugia, and Loa-Loa. Alright? Okay. So that's for the summary, no? So para mas easy ma-remember. Okay. And lastly, this algorithm from Bailey and Scott, no? So if na kayo makita ang microfilariae isolated from the host, we then look at the presence or absence of sheath, no? If present ang sheath, so man-narrow down na niyo siya sa tulo. It's either Wuchereria, Brugia, or Loa-Loa. So we then look at the tail nuclei. If present ang tail nuclei, if mo extend siya sa tip, pwedeng Loa-Loa kung continuous, or kung duhara kabuok, Brugia malayi. And if wala siya tail nuclei, or dili siya mo extend sa tip, then that's Wuchereria bancrofti. So that's for the sheathed. Now for unsheathed, if walay tail nuclei, of course, that's O volvulus or Onchocerca volvulus. And if there is a tail nuclei, if it does not extend to the tip pa rin, M-O-Z-R-D, but if may extension sa tip, it could be possibly M. streptocerca or M. perstans. But always take note that M. streptocerca, shepherd's crook appearance yun iyahang tail. Alright? And the tail of your O volvulus can be bent or flexed. That's why your O volvulus is also known as convoluted filaria. Kaya pwede siyang nakabent iyahang tail or flex. Alright? So that's how we identify your filarial nematodes. No? Again, we look at the microfilarial worms or the larva of your filarial nematodes, and then we look at the presence or absence of the sheath and the distribution of the nuclei at the tail of your microfilariae. All right? Okay, so that's all for your blood nematodes. And before we proceed to the last group of your nematodes, dears, any questions? Yes, ako pang gilantan yung mga gipang chat. Okay. Funny ka. Ano siya pasabot anay mo ang emoji kay? O, pasabot. Okay. Sige. TikTok? Ano TikTok? Pasabot. Anyway, alright. Any questions, dears? Wait, naluya ko ato ha, lunch. Anyway, any questions? Isgot ko ato ha, charot. Nag-gets ready, dears? Okay lang, ato mga mnemonics ha, don't forget. Dami-dami yun. Were very effective for me, so I hope effective din sa inyo. Alright, so Wuchereria, wala. No, wala. Wala siyang nuclei sa tail. Brugia, letter B, you have 2 nuclei, second letter in the alphabet, no? Loa-loa, yes. Loa-loa, yes, no? Pwede mo siya ma-longest voice, so continuous, no? Loa-loa. Ayan. Manzanella perstans, no? Bright pink in your area. Yes. Actually, push ako man joke. Charot. Any question before we proceed to the last group now of worms? Alright, nag-gets lang? And again, it's itong stain na itong gamitin yun para sa sheath, para yun sa sheath. Isa ito siya na stain. Delafields. Okay, Delafields. Delafields hematoxylin. Do not forget. Okay, alright. Teka lang, dears. Let me breathe. Okay, alright. Biscuit ko ato hashtags. Okay, alright. Sige, now we continue with the last group na yun of your, last group of your nematodes, and these are the other significantly important, no? Significant na lang ng mga tissue and blood nematodes, starting first with, of course, Dirofilaria immitis. Now, Dirofilaria immitis, again, this is also known as your dog heartworm, all right? And this is a common parasite among dogs, all right? So it's still a filarial worm, all right? But it usually affects your dogs. In humans, kita, pwede natang accidental, okay? Accidental host. Now, the infective stage is still L3, filariform larva. Parehas sa Japan sa imuhang filarial worms, all right? And the diagnostic stage is usually mga adults, all right? But for humans, mga larva ito makita sa humans, all right? And vector is the mosquito, Aedes mosquito. And for humans, usually if ma-infecta, it appears or it presents as a lesion in the lungs, usually, or mga chest symptoms. And in the lungs, it has a characteristic lesion described as a coin lesion. So mura siya, barya. Ihang shape sa lesion is murag coin, no? Murag barya. All right. So central necrotic area surrounded by a granulomatous inflammation and fibrous wall. All right. So here's an example of a radiograph na ay coin lesion sa lung. Diba? So mura siya coin. Ayan, mura siya coin. Okay, all right. Next, you have symptomatic patients. Again, iyahang symptoms are chest, no? Chest-related cough, fever, no? Malaise, and hemoptysis. So, say hemoptysis na ay blood sa imuhang cough, no? Pag cough ni mo na ay blood appeal. All right. So, because of that, it prompts for a chest examination. And in the chest examination, again, we see coin lesions. Ayan, mura siya coin lesions. Again, mura siya barya, coin lesions in the lungs. All right. The diagnosis, again, is identification of the worms. All right. From surgical or autopsy na specimens. All right. But in dogs, again, ayan, this is an example. It's a common parasite in the dogs, and they reside in the pulmonary arteries, no, sa heart sa dog. And this is an example of a D. immitis worm found in an autopsy of a dog. No? So, nanamatay na dog sa iyang heart na yung worm sa nigawas. All right. So, for the life cycle, as you can see, ang dogs gudi lahang gina-atake, no? So once the dogs are bitten by mosquito, all right, the mosquito injects the L3 larva into the dogs, and the L3 larva will mature in the pulmonary arteries as adults. Okay. Now the adults, of course, will produce the larva, and then makuha na po siya another mosquito, and the cycle goes on. But for humans, if kita mapaakantag mosquito that contains the larva of Dirophilaria immitis, what we get nang is the larva, and the larva does not mature. Okay? Dili siya mo mature into adults, therefore, dili siya makaproduce of microfilariae. Alright? So what happens lang is the larva will be transmitted to our lungs, and dito sila mo create og, again, coin lesions in the lungs. Alright? Because humans, again, accidental, alright, na mapaakan sa mosquito that contains, alright, the larva. Alright? Ayan. So that's for Dirophilaria immitis. So again, what we have to remember, dog heartworm and coin lesions in the lungs. Ayan. So pag na-question na, blah, 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 coin lesions in the lungs, nako, press the buzzer. Dirophilaria immitis. Okay? Now, aside from Dirophilaria immitis, we can also have other Dirophilaria species. You have Dirophilaria tenuis and Dirophilaria repens. These two species, usually, ang ilahang gina-atake for humans are subcutaneous tissues. No? So subcutaneous tissues sila mupuyo. Okay? But again, accidental nga po ng humans, pag mosquitoes, pag-inject nato or pag-inject sa mosquito sa L3 larva to humans accidentally, then of course, the larva will migrate to the subcutaneous tissue, and again, dili gyapon sila mahimong adults, just larva. Okay? And makita dito sa mga nodules, mo forms like nodules, subcutaneous nodules, and the nodules contain the worms. Alright? So that's Dirophilaria repens and then Dirophilaria tenuis, which again causes subcutaneous Dirophilariasis. Okay? Alright. But again, the main definitive host or the main host nila are dogs, alright, or raccoons sa Dirophilaria tenuis. Okay? So that's for Dirophilaria immitis and Dirophilaria species. Okay? Dog heartworm, and coin lesions. Ako, Prezo Pastor talaga. Coin lesions in the lungs. Okay. Alright. Next, we go now to Naphostoma spinigirum. Now, Naphostoma spinigirum, definitive host pa rin are the dogs and cats and other carnivorous animals. So, it uses a first intermediate host, and that is your cyclops, no? Your water fleas. Similar siya with your Dracunculus medinensis, no? Your second intermediate host are the fishes and pwedeng mga frogs. Ayan. Now, paratenic host, are birds and humans. Infective stage is the L3 larva, and the mode of transmission is ingestion of undercooked or raw na mga fish, chicken, and other birds, frogs, or even snakes containing the L3 larva. Okay, ayan. And the worm exhibits cutaneous and visceral larva migrants. And aside from that, it can reach the brain and eye, causing severe damage. Ayan. So here's an example of the worm, of the larva, of G. spinigirum. So as you can see, the body is covered with spines. No, nasa spines. All right. So dili siya, lahi ni siya with acanthocephala. Don't be confused. Acanthocephala, ilang head ang na-spine, all right? But for Naphostoma spinigirum, it's all of their body ang na-spine, okay? And this is the egg of G. spinigirum. Now, once inside the body, parehas ra gyapon siya, the larva will not mature into adults, but the larva will migrate to other organs, causing visceral or cutaneous larva migrants. And once it reaches the brain, ayan, neurologic manifestations are called eosinophilic myeloencephalitis. So don't be confused with eosinophilic meningoencephalitis. Kinsa ganitong eosinophilic meningoencephalitis?
Trichinella spiralis, sir.
Ha?
Trichinella spiralis.
Trichinella spiralis, eosinophilic meningoencephalitis. Trichinella ba?
Yeah.
Saan to? Yeah.
Angiostrongylos, sir.
Okay, Angiostrongylos, sa mga species.
Cantonensis.
Okay, very good. Angiostrongylos cantonensis. So, eosinophilic meningoencephalitis, Angiostrongylos cantonensis. Okay? Ang Trichinella kay Trichinella encephalitis na. Okay? Basta gani, eosinophilic meningoencephalitis, press the buzzer, Angiostrongylos cantonensis. So, don't be confused with that one and this one, eosinophilic myeloencephalitis. So, I don't know the difference, pero basta if na yung mga eosinophilic meningoencephalitis, ang atong answer is Angiostrongylos cantonensis. Okay? But for Naphostoma, once na siya sa brain, it can still cause eosinophilia, and it can lead to death even, because again, may mga neurologic symptoms like paralysis, coma, no, and other neurologic manifestations. Okay? So that's for Naphostoma spinigirum. So again, humans, ayan, the life cycle. Accidental gyapon. Again, when we eat the host, either fish or frog or even snakes and birds, no? Undercooked or raw, okay? And inside, the larva again migrates to other organs, visceral cutaneous larva migrants, and can reach the brain. And once in the brain, it can cause severe infections and severe complications and even death, okay? All right. But in dogs, cats, and even pigs, dito makomplete ang life cycle. So sila mo produce ng eggs, okay? And the eggs, again, once in contact with water, magawas ang larva. The larva will then be ingested by copepods or your cyclops. Cyclops will be ingested by the fish and frogs, okay? And in the fish or frogs, may mo siyang L3 larva. Now, this fish or frogs pwede makaon by humans or by birds or snakes, which are your paratenic hosts, no? And the paratenic host, snakes or birds, okay? Sila na mag-contain sa L3 larva. If makaon po siya sa humans, undercooked or raw, pwede na itong makuha ang infection. Okay? Alright. So that's for Natostoma species. Very important species is Natostoma spinigirum. Okay. Alright. Next, you have Mammomonogamous laryngeus or Syngamous laryngeus. Syngamous at talong. Tsaka, bahay kubo. Ang pangit. Anyway, Mammomonogamous laryngeus, nasa pangalan na laryngeus, no? So, iyahang organ or kung asa siya ganahan sa larynx, no? So, this is a common parasite of the upper respiratory tract of ruminants. So, when we say ruminants, mga cows, mga cattos. Alright. Now, eggs are similar to hookworm. Now, the worm is red or reddish-brown because the worm, adult worm, ingests blood. Alright. And the male and female usually worms are combined together or in copula forever, di ba? Permanently joined in copula, o di ba? Sana all, sige nga, tuwa, charot. Ayan. So, when they form a Y shape, no? And this is an example. The smaller one, kanisha, this is the male, all right? And the bigger one is the female. So, di ba? Common among nematodes, mas dako ginong female ka sa males. All right? Ayan. Now, the worms, again, magpuyo siya sa trachea. So, therefore, imuhang symptoms are usually severe, non-productive cough, meaning wala kay phlegma. No, you don't have phlegm. All right. And the cough is also accompanied by hemoptysis, na blood, or there could also be asthma. All right. So, here's an example of the worms in the trachea of a turkey. Ayan. So, again, Y shape because the male and female are in copula, permanently joined in copula. Okay? All right. Now, in humans, again, humans, accidental na gyapon. All right. Now, ruminants, kani mga cows or cattle, usually makuha nila ang specimen, makuha nilang worm from the ingestion of water, no, contaminated with the larva of the worm. But for humans, the life cycle is not yet well established. There are hypotheses kung paano makuha sa humans. It's either the ingestion of the worms mismo, adult worms from food or water, or the ingestion of the eggs or larva from food or water. So, na mga possible hypotheses. Pero wala pa dyan na ibanan kung unsa gyud, no, ang main life cycle or main mode of transmission to humans. Because these infections of Mammomonogamous laryngeus, they're usually not common din. Okay? So, mga rare lang po siya ng mga instances. Okay? Alright. So, that's Mammomonogamous laryngeus. Syngamous laryngeus. Alright. Next, you have Didactyphyma renale. Your Didactyphyma renale is also known as your giant kidney worm. Ayan. So, nasa pangalan na ba? Renale. Renal. No? So, sa kidneys iyang ganahan. Infective stage is L3 larva pa rin. Diagnostic stage are the eggs. And the mode of transmission is ingestion of raw frog or fish pa rin. Ayan, di ba? So, dami talaga nakukuha kung raw. Pero masarap ang raw. Charot. Check lang. Ayan, okay. Now, adult worms, by the name itself, they like to reside or they like to live within the kidneys. Now, once in the kidneys, they destroy the kidneys. They destroy the kidney parenchyma, and what remains are your capsule na nasa kidney. So, maguba dyan ang kidneys. So, here's an example of an adult Didactyphyma renale. So, diba, as you can see, it's really big. No? Dax yun siya. Yung color red pag yun. Shucks. No? So, big siya. Really big siya. Okay, dako yun siya. Alright. Now, the eggs have a birefringent or striated or wrinkled na double wall. So, here's an example of the egg. As you can see, wrinkled and striated. And birefringent, pwede siyang reflect of light, no? So, birefringent, striated, wrinkled, double wall, iyahang egg sa D. renale. And, ayan, very important, na mention sa CDC that this is the largest known nematode infecting humans. So, ayan na. Paano na yan, Sir Mark? Diba, we mentioned that the largest nematode affecting man is Ascaris. So, sa mga answer, sir, na pwede mo din ang Didactyphyma renale. Kung saan ang buhaton, prayers na lang yun. Pray over. Charot. Bitaw, so ito na ang answer. Basta ang question kay largest nematode affecting man. Alright. If walay choice ang Didactyphyma renale, Ato yung answer, Ascaris, lumbricoides. Pero kung naa ang Dioctophyma renale, then wala na takabacharot. Ano yung answer na lang is Dioctophyma renale. Pero please stick na lang with Ascaris lumbricoides, okay? That is the well-known, you're the largest nematode affecting man. Okay? May mga references na nag-mention na siyang largest nematode. But for CDC na website, it's Dioctophyma renale. True enough, dako gid siya dears. If you want to look online sa mga pictures na ubang pictures aside from this, dako gid siya no worms. So possible talaga na parang deserve din naman na siya ang largest nematode affecting man. Pero for our purposes, if mo gawa sa exam, then we'll stick to Ascaris. Okay? Alright. Nako, prayer na lang talaga. Prayers na lang dyan, dears. Okay? Now, for the life cycle, as you can see, humans, again, accidental ingestion, undercooked fish or frog. And it contains, again, the larva. And inside humans, they become adults and they reside in the kidneys. Alright? And adults, no kidneys, pwedeng ma-recover ang egg siguro sa urine, pwede po sa stool, alright? Yeah, sa kidneys. Okay, so adults are found there. And the adults are really big. Okay, they are big. Alright. The definitive host are usually kanang mga mammals na nasa water. I think ano siya? Otter. Charot, di ko sure bitaw. Pero mga mammals na nasa water. Okay, so sila ang definitive hosts. Okay? Ayan. So that's for renal. Okay. Calipeda. This is your oriental eye. So as you can see, eyes iyahang target. Infective stage is the L fly out na fly. Stage are adults. Ayan, adults. Mode of transmission on lacrimal secretions. So if example sa mga animals, sa mga po ang eyes so tang
Excuse me, sir. Choppy, sir. Choppy!
all right, okay na dears.
Yes, hello, sir. Nana.
Okay. Asa dapit? Teka lang. Life cycle or diri? Sa life cycle na? Asa medyo murag wala na klaro, dears. Sa life cycle?
Oo, dira, sir.
Okay, sige. Alright. So again, balik tano, life cycle of your Thalassia or Thalassia calipeda. Again, it is transmitted by flies, no? Flies, no? So example sa humans, accidentally, makatouch or makaland ang fly sa tuwang eyes, no? And then mo-feed siya sa tuwang lacrimal secretions, possible na dito ma-transmit ang L3 larva. But as you can see, the main affected yun ng mga host na to are cows, your dogs, and cats, no? So again, the fly can feed on their lacrimal secretions, deposit the L3 larva, and then become adults in the conjunctival sac. Okay, so that's for Thalassia species. All right, Thalassia calipeda, again, oriental eyeworm. All right, and the last of the worms are your Lagottial ascaris minor. Now, for Lagottial ascaris minor, it's a normal parasite found in leopards. Okay. Now, in human infections, accidental or gyapon, it presents as soft tissue infections. Okay. There are lesions found in the oropharynx or pwede sa mga soft tissues. Example here, sa child, sa otomastoiditis, diri sa likod sa ear. Alright? So, may mga lesions na ma-form. Alright? Now, inside these nodules are adult na mga worms and even eggs. Alright? Now, humans are accidental hosts. Again, pwedeng nakuha from eating wild rodents that are undercooked or raw that contains the L3 larva. Alright? But again, this is a rare infection lang. Alright? So, again, possible because sa wild rodents kanang mag-hunt or kanang mag-hunt no basta mukha ng raw ng mga rodents. Now auto-infection is possible. The eggs are similar to Toxocara capi, and the surface, as you can see, it has irregular pits. No, so we're not siya mga irregular protrusions sa iyang surface. Okay, so that's the egg of Lagottial ascaris minor. Again, medyo rare na infection, but once humans are infected, accidental or gyapon, and they present as soft tissue infections. Okay, so sa neck, pwedeng sa head, my neck, my back, charot, ayan, ganun. Okay, and inside the nodules, they contain adult worms and even eggs. All right, and that's the end, yes, of nematodes. Finally, after how many days? ilang beses, ilang days tayo nagchichika ng mga nematodes, but finally we're done. Okay, ayan, so before we end, any questions, dears?